This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by the fantastic Dr. Jason Martin.
Extremely fantastic.
Fantastic. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
I'm doing pretty good. Really good, actually.
Awesome. Well, it's the day after Valentine's Day, so hopefully you're full of love.
I totally am.
Yes.
I took care of my wife. I gave her chocolates. I gave her flowers. Took her out to dinner.
Teddy bear.
The whole deal. A hot air balloon.
I'll be sure to go back in time and tell my past self to send your wife flowers.
Yeah, exactly. What else did we do? I can't remember all the things we did. It was so amazing.
It was that good. That's awesome. Like sleigh ride. Oh my gosh. So like 1,000 years ago, way off topic for everyone who's listening. You can find this episode on YouTube at Jason Martin MD, and all of our social media handles are in the link down below. We are going to be talking about tummy tuck myths, but first I have to tell a funny story, only because you brought up the fabulous date. So remember Kelly, our front desk person in Aspen?
Of course I do.
Shout out to Kelly. So we were talking, and this is going back, I don't know, 14 years at least, about The Bachelor, because at the time The Bachelor was a relatively new show,
which is still on.
It's still on, which is
just like what is crazy. Going on? It's gonna be 30 years from now. It's gonna be like what are those soap operas are still on, like General Hospital? Like that's still going.
Yep.
It's gonna be The Bachelor.
The Bachelor. So we were talking about how unrealistic it was that people could like fall in love in this very compressed time frame, and she said, of course they do, because they go on dates to like the moon and ride dinosaurs.
Yeah, that's true. That is pretty funny.
Like the forced fantasy of it all, and how that can cause a person.
The problem is when the show's over, so is the relationship.
Exactly. I don't think any of them have lasted. So way off topic, but enjoy that post-Valentine's Day non-love story.
We're talking about tummy tuck myths.
We are, and just like our episode,
we're very much myth busters.
We are, because you know what? There's a lot of myths out there, and a lot of the questions we get are actually kind of myths that we bust on a continual basis. So I thought we'd just knock a bunch of them out all at once.
We don't tear you down.
Well, it's not that it's their fault. It's a myth. The myths are not like their own personal myth usually. They're myths they've heard. So
good point.
I'm helping them. But you can find in the description box all the timestamps. So if you just have no interest in hearing 9 of the myths, then maybe you want to hear the 10th one.
And you're not going to acknowledge that we have a guest here
in the studio?
Yes.
I know, we do. And she hasn't been here since our very first season of the podcast. We have Sarah. Shout out to Sarah. If Nils had another camera, he could put it on Sarah. So Sarah does all of our amazing slides. This time I didn't give her a whole lot to work with these slides. They're just myths and they don't have a lot of fun pictures. But the slides that do, like Sarah does an amazing job.
I think it would be fun to do this show in front of an audience. I think that would actually work well for us. I think most people don't like to be in front of an audience. I can't consider Sarah an audience. She's like a family member. So it's not as much. Maybe.
I'm not going to think of Nils as our audience. Remember the COVID days when we had a podcast without anybody here?
I mean, if you watch this long enough, you know I basically try to make jokes and then look at Nils and see if he laughs. Okay, so that's all I do. That's basically my job.
To make Nils laugh?
Yes.
Yeah.
And then maybe talk about some information that people might care about.
Yeah.
Okay.
Well, maybe one day we'll do an episode like in the OR. That would be pretty cool.
Yes.
Let the OR staff ask us questions.
Yeah.
Think the patient might not consent to that? Okay.
It's like letting the animals out of the cage, and I'm in the cage. I'm not implying that I'm not one of them. So, all right.
Yes, you are in the cage. So again, there are 10 myths today, and if you're interested in just seeing what those are, you can look in the description box and jump ahead to whatever myths you want to listen to, or you can listen to all 10 myths. And we would love to have you here for all 10 myths. All right, Dr. Martin, let's hop in. It did the reverse. So like last time with breast dog, I buried the lead. I put the very biggest myth as the last myth. This time I kind of just went all in.
You did the Missy Elliott. You flipped it and reversed it.
Yep. So let's read myth number 1.
You want me to read it?
I do.
Okay, I'm going to get my very deep voice that I did when I read. Having a tummy tuck means I don't love or honor my post-baby body.
Yeah, mom guilt through and through. Like how often do we have women who come in and they feel like they're failing? because they are thinking about getting a tummy tuck when they think they should, quote unquote, love their body because mummy tummy is big. And like everybody thinks that, having a tummy tuck, that no one they know has had one, which is also not true. That's not one of the myths, but that's also not true. Especially funny when you work in a very small town like we did for a very long time and people would come in and say that none of their friends had done this. I'm like, yeah, they have. In my mind, I'm like, oh, okay. But yeah, that's such a big one. And I put it as number one because I think this is absolutely something that should be busted. Like you having loose skin or a diastasis has nothing to do with you not loving your body.
Right.
And wanting that loose skin to go away for functional reasons, for lifestyle reasons, just to feel like yourself again. None of those things take anything away from what your body did to grow a human.
Right. And the second part of it is you see this progression from there on to am I worth it? Is this, why am I doing this? Why am I investing in myself?
Right. Or I'm risking my life for this.
Right.
I should just be happy.
I should, I should invest in my children or my family and stuff like that. And the reality of it is we've established that cosmetic surgery does not make you happy, but it can empower you. It can check a box. You can make yourself feel better about yourself, which translates positively into all your personal relationships, including with your children.
Absolutely.
And your significant others and your plastic surgeon and your plastic surgeon's office manager, all the people that are in your centroid that it surrounds you. So I do think that this idea that you may not be worth it for whatever reason, right? Or that it's a trade-off for something else is ludicrous.
Yep.
With that said, if you have a post-pregnancy belly and you love it, that's awesome. We love that you love that. So we're not judging the way you look. This is about you being the best version of yourself, and it has nothing to do with anyone else, actually.
Exactly. Like we don't judge it. Like we don't judge you for wanting a tummy tuck in the slightest, like at all. And you shouldn't either. Like this is something that you didn't know was going to happen. You grew an amazing human. Like no one can take that away from you. But what we can take away from you is loose skin.
Pregnancy is a total head trip. I mean, it really is. I mean, I know I'm a doctor. I know everything that happens. I know all the steps of pregnancy, and it's just really amazing.
Well, the really freaky thing is that you can do this in 9 months.
Oh, I know.
I mean, that's what's really trippy. Like you can literally grow another person inside your own body.
Yeah, just
in a short amount of time frame. Yeah. I mean, really, you think elephants, they're 2 years gestation period. That seems more like in line with growing a human.
Right, but no, that's not what happens.
It's amazing. This is like the 10 sheep comment. You got a lot of cells you got to produce in that amount of time.
Yeah, so it's okay if you feel strongly about having keeping the changes you had after pregnancy, but a tummy tuck is one of the most transformative surgeries we do. All you have to do is look on our Instagram account and see these changes. It's pretty remarkable.
Yeah.
So,
and your body is just as powerful as it was the day before your tummy tuck as it is the day after.
So I still want to do the myth busted. Is it okay?
Oh yeah, you can say busted.
Busted.
And then there's the stamp. Yes. All right. Myth number 2. This is one of my personal favorites.
See, I made Nils laugh. So.
Yes. Myth number 2. This happens all the time. Women come in and go, can't you just do this? And they pull up on their breasts.
Everyone listening on the podcast loves when you
I was just describing what I did. They pull up on their breasts and say, can't you just lift my breasts and my stomach at the same time? And the answer to that is no.
Well, you can. Technically, it's called a reverse tummy tuck.
But that's not going to get all the skin below your belly button.
No.
That can help with the laxity you have from your belly button to the base of your breast.
So, Amy, how many times have we done a reverse tummy tuck in my career?
0, because it's awful. I mean, it's a terrible place.
I'm not even going to argue this time with her acerbic comments, which is like every time, but it is awful.
Yeah.
It's like literally the worst surgery.
Well, and you're fighting gravity in the wrong direction. Right. You think a tummy tuck, you're pulling the skin the direction gravity wants to go. What's that going to mean? Long lasting results. Best scar possible. Pulling it in the reverse direction against gravity means short results. It's like a brow lift.
Right.
Brow lift is probably the shortest results of any surgery we do because gravity's constantly pulling it back down and it's mobile.
Yeah.
So you're going to put a scar in an area that's going to be visible in almost all clothing that shows your midriff. It's not an efficient way to do it. It's very inefficient.
Yeah, we always talk about what's the be like water? Who said that? Bruce Lee. That kind of like Asian philosophy where you go with the energy, not against it, and that's the same. It always works with gravity. Mm-hmm. So it's harder to pull up unless it's a small area like a brow
or a face.
Yeah. But when you're talking about breast and stuff, that's why breast lifts, it's hard to keep those in place. You have to do a lot of work to kind of keep that up.
And Yeah. And like we had this conversation with a patient this week who's only 37. She needs a breast lift. And I straight up said to her, like, know in your mind that 10 years from now, just like 10 years ago, like you will probably need another lift if you want to keep your breast in the same position.
Yeah.
And she looked kind of shocked. I'm like, well, gravity, age, all these things that have made your breast sag to this point, 10 years from now will have happened again. And those, so with a tummy tuck, we'll talk more about whether or not you would need another tummy tuck, but this is one of the surgeries that is kind of an outlier in cosmetic surgery that you can actually pull in the direction of gravity, which is, there's so many benefits to that. So why would you fight that when you don't have to? When you have a great solution, like why?
Because you can.
Right. Well, because people think they can. And
that's the American way, because you can, America.
Anytime you yourself pull on your own skin and expect that it will stay there after surgery.
Everyone comes in pulling crazy.
Right. You're probably pulling
if you want a thigh lift, they're pulling up their skin. They're almost ripping it off.
Or same thing on the face, the breast, anywhere.
They're like, can you do this? And I'm like, but you would probably be in an ICU.
Right. Or pull my arm so tight I can't put my arm over my head. Like
you would never be able to move your arms again, but they're going to be tight.
They'll be tight. You can't put a shirt on like a normal human.
Yeah.
So yes, as tempting as it may be to think that this would work, it does not.
So to this, just to act like a real plastic surgeon. So a lot of people ask, like, so if you're going to do a tummy tuck and then a breast reduction at the same time,
or a breast lift at the same time,
do you do the breast lift first or the tummy tuck first? And I always do the tummy tuck first because I allow that skin to be pulled down, so then I know what the true inframammary fold's going to be.
Yeah.
If you do the breast lift first and then do the tummy tuck, you could theoretically pull on that scar down, which would then move the scar past your inframammary fold at the base of your breast, which might be visible with a bikini.
Yeah, and again, fighting gravity. So what are you going to do? You're going to pull down first with gravity, pull as hard as you possibly can, and then you're going to pull up.
Yeah.
Like, makes way more sense. Yeah. Okay.
Well, busted.
Myth number 3. This one goes to you.
Can we just do a show of busted?
Just you saying busted? That's like some type of weird GIF. Someone can make that if they care enough to make a GIF of Dr. Martin just saying busted over
Someone
and over
made a GIF.
again.
Who was that? It was one of our employees.
It was me, and it was me that made it of you going, yes.
Yes.
And I send it to you still. And I send it to other people all the time. Even people who don't know you.
I sent that to my friend, and he goes, who the hell just made a GIF? Is it GIF or Jiffy?
GIF.
Okay. GIF?
I go with GIF.
GIF.
Do you know? Is it GIF? Okay.
Yeah. Don't believe me. Yeah.
Okay.
I'm on that side.
Yeah. Okay. If whatever Sarah says, that's what it is.
Yeah, I made it, and I'll send it.
She's a representative
I'll
from the
send
internet.
it to Sarah, and maybe Nils can insert it here.
Yeah.
It's really low quality because it's old, but it was. We were talking about what the name of your memoir should be. Do you remember that?
Yes.
And you seriously, like, you were looking at me, and you looked at the camera, and you went, yes. And it was like the best ever. So yeah, I made a GIF of that, and it says yes.
That's what we do.
Yeah, and it's awesome. So, all right, myth number 3.
Okay, everyone will see the scar.
I love this. I love when people say big, grandiose things like everyone will see the scar. Like, what are you doing? Walking through the grocery store naked? Everyone. Who is everyone? Like, people that see you naked will see the scar.
There's a couple times I've been in the grocery store. I feel like the people that were next to me probably wanted to walk through the grocery store naked. They were either severely inebriated or had clear mental illness, but most people don't walk through the grocery store naked.
Right. Or even in situations, who are these everyone, A? And yes, people who see you completely naked will see this scar. 100% they will. Perhaps. I tell the story often of the patient who had the thigh lift, full thigh lift. And then she came back to be a demo patient for me when I was doing a treatment for like urinary incontinence, which included me being in the position that an OBGYN would be in, looking straight up at her scar area. And I had completely forgotten we'd done the thigh lift. I didn't even see it.
We had a patient that we're going to do some extra liposuction on, and her scar, 8 months, maybe 10 months old, and you can barely see it now.
Yeah. So will people see the scar? Yeah. People that see you naked will see the scar.
Especially when it's healing.
Yep. Will everyone else see the scar? Maybe. It depends on what your lifestyle is. If you wear extremely skimpy bikinis with like string ties that are really little, like, yes, your scar may pop out. But if you're wearing a bikini, even with like a normal like 1-inch band that goes all the way around, is anyone going to see that? Like,
nope.
You can literally put it right over that area. On a rare occasion, there may be a time where a
Again,
patient...
I don't want to like pile on, but every Kardashian has the bikini that goes over their tummy tuck scar.
Yep.
Besides the young ones. So they have all had tummy tucks, and they all do photos that show their midriffs, and they look you don't see the scars.
Yeah, and there are rare times. I mean, I like to be very honest with people. Like if you have a lot of excess skin that goes around the sides, like back toward your back, your scar may slightly dip below or above where the rest of your scar is, just to kind of chase that out. So are there times when maybe someone would see it poking out of the edge of something? Maybe. This is also then where I ask people, like, what do you think that someone is going to assume that tiny little bit of a scar that they could see is from?
So why are we concerned about what people are thinking? That's the real question.
Well, why do we just assume that everyone knows what we've had done because they see a scar on our body?
Yeah, and secondly, you look kick ass.
Yeah, who cares?
I mean, I'm not a woman. We're talking about bikinis. Men get tummy tucks, by the way.
That's
okay.
Don't jump on my myths, man.
Okay, sorry.
Always jumping on my myths.
Damn it. I blew it. Yeah, but so in sticking with the female post tummy tuck with the bikini,
men wear bikinis.
Yeah, but you're going to look amazingly better in terms of the way your torso looks, your contour. I mean, these surgeries are transformative. And the idea that the scar, which is at the level or below the top of where your pubic hair goes, okay, that's how low it is, at least with me. Who is going to see that? In what scenario are you showing someone that area?
Well, I mean, the area on the sides.
Seriously, no, I'm being
no,
dead serious.
I am too. And the area on the sides around the hips can sometimes be visible, even with a swimsuit.
Secondly, so the way you inset your umbilicus or your belly button is a big part of a tummy tuck. That's your signature. Okay. I give up.
Stick to the myth. Remember we had this conversation last time.
Nobody's
Everyone will see the scar. We're talking about the scar. So yes, and again, if somebody does happen
I should really read these beforehand.
Peek a glimpse of your scar, they don't know that was from a tummy tuck, and who cares if they do? Like Dr. Martin said, you're going to look so amazing, you're not going to care. But will everyone, quote unquote, see your scar? Absolutely not.
No.
Yeah, that is a myth.
Unless you have one of those sheer Lululemon pants they got in trouble for, then you can see the scar through it.
Maybe. Yeah. All right, do your busted so we can move on.
Busted.
Okay. All right. Number 4. Here you go, Dr. Martin.
Okay.
You will make me a new belly button.
That's not technically what I was saying, but it was the same category.
I've even had people ask me when they get to choose their belly button.
Yeah. We have 4 styles, and then we got sponsored by Hermes lately.
Yeah.
So we have an Hermes, logoed umbilicus. So no, your umbilicus is your umbilicus. Your belly button is your belly button, what God or nature gave you. When you were born, there was the 2 veins in one artery. Do you remember that?
Yes.
From anatomy class. Yep. And that's what fed you as a fetus or as a baby. And then when you're born, they clamp that. You see it in all the movies. If you've had kids and they tie it, that kind of necroses off and goes down to a belly button. Yep.
And your little stump falls off. It's a real weird day.
And I still use the same one. Now, those belly buttons can change over time with weight gain. The stalks of the belly button that connect to your fascia and the muscle underneath can get longer. The belly buttons can get effaced if you have a bad diastasis. We see that a lot. People have hernia surgeries. People have hernias in the belly button. That's real common
like
after pregnancy,
outie.
umbilical hernia. You have all these presentations. So a lot of times when people come to me, their belly buttons are all jacked up.
Yep.
And so I definitely make them look better, but it's the same belly button.
Yeah, we do cut around it, and that is again stories from Dr. Martin and Amy. We did have a patient who I was on my way to boxing one Sunday morning and texted me that she was having some leaking from her belly button, and I was kind of like, oh my gosh, like, okay, I'll see you at the office. So she comes in, and I'm like just expecting to like see a little bit of leaking and have it be fine. Well, so I get her up on the table, I shine the light on it, and I'm like looking and looking again, and I'm like, there is nothing here. So I called Dr. Martin. I'm like, she pushed her belly button through, and you were like, what? I'm like, yep, like literally pushed it down to this, like to her abdominal wall. So she had been cleaning it with a Q-tip, and you can't really feel it because it's numb after surgery. So she accidentally,
she dehisced.
Yeah, it dislodged. So the belly button was down on the abdominal wall still, but the rest of the skin was above it. So it was a hole with the belly button. So Dr. Martin, I prepped it, was like literally like pouring betadine in it. And Dr. Martin came in and we just pulled it back up and sutured it back up. I mean, still the same belly button, put it through the same hole, sutured it back up, and it was fine. She was totally fine. So don't make you a new belly button. We do make a new hole for your belly button.
It's so funny. I don't remember these stories, but then when you say them, I remember them. I think it's like for my mental health because it's so anxiety provoking.
It was. I missed boxing that day, Nils. Yeah, that was where I was. Yeah. Man, we literally just get it. Yeah,
where's Amy? I don't know. There's something with the belly button.
Yep. Belly button fell off in. But we do make a new hole for it. And that's, that is the difference. We literally cut around it.
At some point, I'll do a video on belly buttons because I think that's kind of important. Mm-hmm. But the way I do a belly button, I sew the deep dermis, the deeper layer of the belly button, to the deep dermis of the abdominoplasty flap and the fascia overlying the abdominal muscles in 4 quadrants. So it invaginates the belly button. Imagine an outie versus an innie. Innies look way better when they heal. The outies don't, because you see this circle scar around the belly button. If you go on the internet and look at people's tummy tuck results and see this circle scar,
like a donut around their belly button,
where the belly button is, it just looks like crap. It's just really not a desirable outcome. So I try to invaginate it down, just like it is normally, for anyone with a somewhat normal belly button. So umbilical hernias are real common, and there's so many. I don't know what the disconnect is with the layperson. I've seen so many people, like friends and stuff, and they come and their belly buttons are all distorted because they have a hernia there. It's usually people a little bit overweight. You know,
Courtney's my favorite example.
Courtney's a great example.
He's a terrible umbilical hernia,
and you're like. And you'll say to them, you're like, you have a hernia. They're like, what are you talking about?
Yeah. And we was so lean to compete. Oh my gosh. It was like, it looked huge when he was on stage.
Right. And
it's like the size of like a walnut. Yeah.
Right. And it was like, they're like, what are you talking about? I'm like, you have a hernia in your belly button? No one's ever told me that. I'm like, have you ever had a physical exam with a doctor?
Oh, but some doctors probably don't even look at that seriously.
Okay. Well, that can get incarcerated. That can be a surgical emergency. If you have an umbilical hernia, a hernia of your belly button, get it fixed. Mm-hmm. All right.
Male or, and this can happen to men or women, and it's not always an old person thing. I mean, there's inherent weakness there, like Dr. Martin said. I mean, that
a rectus diastasis, splitting of the muscles with pregnancy. There's a good video on our YouTube channel on rectus diastasis and repairing that. That is when that muscle splits open, the fascial layer between the muscle. Stop doing that. You do this all the time. Like, you do this all the time. You tell me to stick to stuff.
Right, and that's because the next thing was coming.
Okay, well.
So you don't think maybe we'll talk about that?
I mean, I love you dearly, but I need a little bit of wiggle room here. But then my point is, with the diastasis, with the splitting of the muscle or the splitting in the inside, the kind of fabric in between that's underneath where your belly button is can kind of loosen, and that's then secondarily you can get the fascial defect, which then leads to the hernia.
Yep.
Yeah. I love you. I'm just joking.
It's all right. I just it's like they're myths. We gotta keep them as individuals. We'll get to the myth. We'll have nothing else to say.
Fully aware.
We'll reference myth 4.
If I ran this podcast, I would be talking for 45 minutes on nothing, right? And no one would get any information. So the only reason that this is informative, educational, is you, and then Nils's guidance and Sarah's slides. So
just make sure people know where to go for the info they're looking for.
That's a good point.
That's no reason. Yeah.
What is that myth?
Number 4.
Excuse me.
Oh.
Busted.
Myth number 5. Dr. Martin.
Oh God. I have a concave.
I will have a
concave or completely flat abdomen.
Yeah.
Oh, this is a really good one.
Yeah.
You always pick the best ones out.
Sometimes completely flat is accurate. Concave is not realistic for a normal human who's had a baby.
Right.
Or who eats ever.
And people are like, why can't I have a concave abdomen? I'm like, because you have organs on the inside. And in some cases, fat, if you're not 0% body fat, that's called omentum. And that fat is there to protect your organs. So if you have a rupture of something or an infection, that fatty layer surrounds it and walls it off. It's protective. I mean, that's from evolution. So you're not going to take that out so you can have a concave abdomen. And most people don't have concave abdomens, even at a lower body fat percentage.
Yeah, even people who have really low body fat. I mean, I think a lot of that concave look comes more from how far out your rib cage is versus your hips. So if someone has a pretty broad rib cage and very narrow hips, then they might get more of that concave kind of look because their ribs are sticking out a little farther than their hips per se.
Totally.
But that's not normal physiology for all people. Let's talk about the completely flat, because most people, when they think completely flat, they kind of are meaning concave-ish still, and again, there's fat, not just the omentum. There is fat that is underneath things, especially men tend to have this more male pattern fat distribution is more around the belly. Well, that fat can be underneath the muscle, not in front of it. So if you have fat underneath the muscle, but above your organs, right, you can't get that. So even for women, there are some women who just carry a little more fat there. If your abdomen is very rounded prior to surgery and you have laxity, and the laxity, we can get rid of the laxity, absolutely.
And you can tighten the abdominal wall too, which helps.
To help. But it may not be completely flat. A lot of it depends on where you start. And we have a good example of this actually on our Instagram page, a patient who, her abdomen is flat, but is it concave? Is it still somewhat, there is a natural sway to it? Yes. It's flat, but it still sways out a little.
Right.
There's no loose skin there. It's tight.
If you start with a lot of girth, subcutaneous fat on your belly beforehand, you can't get rid of all that fat with a tummy tuck. People think you're going to go liposuction that and then tighten the skin. If you do that, then the blood supply to the flap itself and healing won't be there, and you'll have a high risk of postoperative infection and wound breakdown. So you have to maintain the blood supply. There's only so much fat you can remove. In plastic surgery, they talk about, what is it, the name? Scavenging fat, removing that at the time of surgery, which I do. But you still can't remove all the fat that's there. So if you come in with a real thick abdominal wall in terms of fat and you do a tummy tuck, you're still going to have girth there afterwards. And that's the typical patient. And there's nothing wrong with this. But if you ever talk to someone, my aunt or my friend did a tummy tuck and she still looks kind of bigger afterwards. Well, if you come in with real thick abdominal wall, you're still going to have that afterwards. You're just going to get rid of the excess skin and maybe tighten that underlayer a little bit with a muscle tightening procedure, the diastasis repair. And so it's important that if you're that type of person, that you have realistic expectations, and that if you go into some office and you're already a thicker person, which is great. There's nothing wrong.
You're really an apple shape. I mean, maybe very little, but apple shaped.
Yeah, maybe you're 5'2", and that's just the way you're made. Apple-y. Right. Then you're still going to be a little bit of an apple afterwards. You can't change your body type, and that's hard. And so and this is the hidden secret. Like even on my website, there's some pretty amazing transformation on our website for tummy tucks, but a lot of those are taller women, right? Because they have more to work with. There's like more length there, so you can really define that torso. It's just a longer torso, as opposed to something that's kind of compressed in between the breasts and the hips.
Yeah, and really, tummy tuck is addressing the fat, but it's mostly addressing the skin. That's really, and the tightening of the abdominal wall if you need it. So they're two different things. The thickness of the abdomen and the excess skin of the abdomen are separate. And there definitely are times where, someone maybe just has like a little more thickness so much than skin. So we'll just lipo, right? Really aggressively lipo. And then tell them you might need a tummy tuck after this.
And the reverse is true. A lot of people come in with a lot of post-pregnancy changes, weight loss changes, and they have a lot of excess skin. They have split abdominal muscles, diastasis recti. And then what we'll do on that is we'll do the tummy tuck and we'll say, hey, we're going to come back later on and liposuction the rest of this. That's an amazing result, because then you can take down the girth after you've tightened all the skin and the muscles. Yeah. And that's usually 6 months afterwards. So that's not common, but when we do that, the results are pretty amazing.
Yep. Yeah, I mean, there's options. It's just having realistic expectations and kind of knowing where your body is to start. And that's where it's helpful. And that's why we do have pictures on our website of a lot of different body types. You can have an amazing result from your tummy tuck and still have your same natural curves in your body shape. Still going to be the same.
Don't you think the concave thing is more about how they take the photo? So they hold the phone. Well, watching the YouTube channel. Yeah. I'm sorry. This way, you hold the phone, and then they turn their body, and then they suck their stomach in. Yeah. Everyone's always like this.
I mean, I can do a stomach vacuum and make my stomach completely concave, but I can't breathe at the same time.
But that's not real. They're like completely sucking in their stomach. Yeah.
Well, but I mean, also, when you look at a person standing, depending on how much your hips are rotated forward, and a lot of other things can make your abdomen appear protruding when it isn't. It's as tight as it can be. But there's just things there that are causing it to look somewhat, like I said, it's kind of swayed out or bowed out slightly. Yeah. And it's a lot of hip position.
If your bladder's full of urine, it's time of the month for a woman with your uterus. Yeah, I mean.
Yeah, you have a uterus, ladies.
Yeah, if you have gas.
Yes.
Yeah.
Your
Sorry,
stomach might
did I say that word?
Bit.
Sorry to pop everyone's bubble there. Yeah.
So,
I mean, it's so outlandish, and this really gets into where we are with imagery and our culture and stuff like that.
Yeah, but either way, even if you are an apple shape or carry a little bit more thickness through the middle, it'll still be flat.
Yeah, it'll be less apple-y too.
But it's not going to be concave.
Yeah.
So I do have I can share some videos with you if you want to learn how to do stomach vacuums to take selfies with. I can send you those. And they're actually great for strengthening your abdominal wall. So I have a lot of our patients do stomach vacuums after tummy tucks, actually.
I have no idea what you're talking about.
Yeah.
I really have. What's a stomach vacuum? Is it literally
on
like
the
a
break,
Hoover?
I'll show you.
Okay.
Yes. So on that note, we're going to take a quick break from our sponsors.
I feel like you have a whole other life that I don't know about. Like, what are you talking about?
Stomach vacuums in the sauna in the morning. Yeah.
No.
Yeah. All right. We'll be back.
We'll be back.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically, you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like, you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like, is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs, or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
Yeah. We're back. Getting your labs checked is no myth.
And watching Amy do stomach vacuums is blowing my mind. If we did this on YouTube, we would get 100,000 subscribers. Yep. She did this crazy, it was almost like a belly dancing thing. How would you describe what you just did?
Yeah, I mean, it's like you're really compressing your abdominal wall.
The only problem was you can't breathe. Okay. No. So at some point you're going to pass out.
Yeah. I mean, I know that you can, like, if you train yourself, like, you can maintain it and breathe through it, but I have not gotten to that point. I can hold it for a long time, but I can't take a breath.
So Sarah was saying that's that's what the body competitors do.
Yeah.
Yeah.
Yep. A version of that. And they also do it just to kind of help bring in their waist a little bit.
That was crazy. Like, you shrunk down your stomach area like inches.
Yeah, it is. It's inches. It's crazy.
Yeah.
But that just shows that like a lot of what is causing that girthiness of your abdomen is things like your organs. And like, yeah, you can compress them
because what you're basically doing is that you're probably drawing up your diaphragm, sucking in your muscles, which is creating more of a
just pressing on those.
Pushing those organs back.
Which if you have a lot of stuff in your intestines feels real bad. Yeah. Best to do on an empty stomach first thing in the morning.
All right.
Yes. Okay. Let's jump back into our myths. We made it through the top 5 and now we're on the back 5.
Kind of like golf.
Back 5, yeah, we're on the back golf. 9. Back 9, you know.
Back 9, back 5.
Pop a beer. Yeah. Back 9. Yeah. I know.
We should have a drinking episode because you and I really don't drink. That would be a good one too.
There are podcasts I think that do that, like drunk episodes. I mean,
this is Dr. Martin, the Barn Certified Plastic Surgeon.
Catherine reminded me today. I said something about like there was a song on talking about there being a hole in the bottle of wine. I'm like, I love this song in theory, but like I don't remember the last time I had wine.
Yeah.
She remembered. It was last February. So yeah. All right, so number 6. Liposuction can give the same result as a tummy tuck. You see this all the time online now. I love it. The Sonobello commercials. Like,
Sonobello.
They call it a tummy tuck. It's liposuction. Yeah.
It is not.
It's not.
Yeah.
Not even close.
So if you watch our stuff, you know that we do energy-assisted liposuction, body type. We've used Smart Lipo. We've used Vaser.
LipoLife.
We're doing Beauty Fill now. So
LipoLife when it's just lipo.
Yeah, LipoLife.
It's the worst name ever, but yes, it's laser assisted liposuction.
Sorry,
LipoLife.
I don't know all the marketing names. I apologize. So anyways, all these use energy to tighten the skin and also melt the fat, and then helps liposuction work better. It helps a quicker recovery. But the amount of skin tightening you can get in the best case scenario, like something like Body Tight, is maybe 30%. The amount of skin tightening I can get with a tummy tuck is like 100%. If it was Spinal Tap, it would be level 11, like literally more than 100%. That's what it feels like. There's no comparison. Yeah. None.
There's none. And, I love those, again, the Sonobello commercials, or like you see the ads on YouTube. Hopefully there was not one on this podcast episode. The person's in clothes and like, is there less girth to their abdomen after liposuction? Sure. I guarantee you their abdomen looks way worse after that liposuction than it looked before.
You could do the Amy stomach vacuum, stand up straight and turn your body slightly.
I could be my own before and after right now.
And it looks great. By the way, we should just do a before and after BS episode.
Yeah.
Because everyone, it's like, so every before and after on the face, the neck's down like this, and it's shadowed, some funny shadow. And the next one's like this, the neck is up. Again, I'm doing exactly what you did, so no one can hear what I'm doing. The chin is up, and the lighting is perfect.
Tummy tuck, arms are straight over your head, like you're Superman flying to the sky.
Yeah. I mean, I can't even look at Instagram anymore because every picture is like that. It drives me absolutely bonkers. It's not, what's the word I'm looking for? It's misleading. I don't know the word. There's something greater than that. It has this feeling that they're trying to pull one over on you. So in reality,
it's manipulative.
There are some patients that you could go either way. Maybe you could do some liposuction now and a tummy tuck later, tummy tuck now and liposuction later. There's some patients that for mini tummy tucks that maybe could get away with Body Tight, right? So it's only the lower part of the abdomen, below the belly, or below the belly button, and above the pubic hair area, that maybe you could do Body Tight alone. But that's like few and far between. Most people either need a full tummy tuck or not.
Yep. So
it's not apples to apples. No, and the reason they want you to believe that is that they want you to come in the office and do an in-office liposuction, pay $5,000 or whatever that number is, and make you think you're getting a tummy tuck, which they say is cheaper than a tummy tuck. And it's not worth the money you're paying, because you're not going to get what you think you're getting. And that's really important for people to understand.
Yeah. The one thing I remind everyone with any type of assisted technology or liposuction, it can't cut and it cannot remove skin. It can remove fat. But if you have excess skin anywhere on your body, your face, your arms, your thighs, we've talked about all of these procedures in previous episodes, no amount of energy is going to remove that skin. Tightening, in this case, means it's bringing it closer, right? So if you have
We can't say shrink wrap because Amy won't let me say that anymore.
If you have a lot of laxity and you have a lot of excess skin,
we can shrink wrap your skin.
Getting rid of the fat that's underneath it will make that skin looser.
Right.
More lax, more hanging.
Actually, it's worse against you. The more fat you take out, the worse the looseness you could make it.
Yep.
afterwards.
And the more distorted it might look.
Yeah.
You know, and absolutely, we have patients who, for whatever reason, don't want a tummy tuck. And they know that they're going to have loose skin. And they don't care. They just want...
And they're extremely happy too.
Yeah, and they just want their clothes to fit better. You know, they don't care if they have loose skin. They just want their clothes to fit better. Fair. You know, but we tell them that. It's the same thing with a face tight versus a facelift. There are people who are like, no, I will never have a facelift, but I might do face tight. Like, well, it's not going to address any of your loose skin.
It'll address it a little bit, but not much.
Right. Not to the extent that it's not to a surgical or meaningful extent that you could call it an exchangeable procedure for the other. So liposuction is great. We have episodes where we talk about liposuction.
We have a really good episode, a really good video on our YouTube channel, face tight versus mini facelift. That got a lot of action, and I understand why, because you can really see there what face tight does
on a young person who was a candidate for it.
And then what she looks like after the mini face and neck lift, and it's like no comparison. Yeah. It's crazy. It's totally crazy. Like the mini face and neck lift was transformative for her, where the face tight was like, yeah, it's definitely better, and that's basically it. And we're the office that does all these in-office procedures. We're not dissing on it because we don't like it. We do it every week.
Yeah, but we give people realistic results, not telling them that it's going to mimic surgery when it's not.
So it is funny because we get a lot of consults in here. People are like, oh, you're the face tight guy or the body tight guy, and like, you do all these special things. I'm like, no, it's not a tummy tuck. I'm like, oh, really?
Yeah. Sonobella says it is.
Disappointing. Yeah, Sonobella says it is.
Yeah. But and we do have a lot of patients who've had kids who just need a little bit of lipo on their abdomen. They are genetically blessed. So it does happen, but they're not interchangeable procedures at all.
Hold on. Busted.
All
the
right.
finger point is very important with that.
You get number 7, Dr. Martin.
Just flipping the script a little bit. Yeah. Oh, Amy, myth number 7. Drainless surgery is superior.
Sounds good, doesn't it?
It does. Yeah.
Yep.
If you are lucky enough to go to a surgeon that doesn't use drains,
that does drainless surgery,
your outcome will be amazing.
So
I feel like we're doing the NPR routine.
Yeah.
You know, the sweaty balls thing.
All right. Yeah.
Oh, yes.
So, Dr. Martin.
Drainless surgeries, yes.
Yep. So this is buzzy, right? Everybody wants to have drainless surgery because drains are pain. Drains suck, like real bad. And I tell people
No pun intended.
They are terrible. They do. They siphon. Well, they siphon. They don't suck so much as they siphon, but they're terrible. They're annoying. But however, once someone sees literally the hundreds of cc's of fluid that are coming out of those drains the first week after surgery, they very quickly realize why that might be a problem if that was building up behind what we have made a super tight abdomen. Now, are there quilting sutures? Oh, well, there's a technique. No. There's no technique to stop you from swelling.
Yeah.
So yes, can these things help the lymphatic system be less affected? Yes. However, if you need drains after surgery, your surgeon put them in because you need them, not because he's sadistic and wants you to suffer for a week with these drains in place. So your drains are there for a reason. With our types of mommy makeovers and tummy tucks, we tend to do a lot of flank liposuction or liposuction of the sides or that area that hangs over your pants in the back. That also swells a lot. So you're going to have inflammation that's coming from the liposuction areas on the back. You've had us cut through all your lymphatics of the abdomen. Swelling would be a real problem, and it can really put a lot of pressure that we don't want on what we have pulled as tight as we possibly can.
Right, and that's swelling of the soft tissue you pull down and also swelling underneath in the form of a seroma, S-E-R-O-M-A. So that's what you want to avoid. There's been a lot of movement in plastic surgery to do quilting sutures, which is to plicate the flap to the abdominal wall from your rib cage down to your pubic bone in vertical fashion. And you're bringing down the abdominoplasty flap onto the muscle and securing it there. So you obliterate that open space where fluid can form. So it definitely works well, but there's no technique like that for the flanks. And if you do a tummy tuck correctly on people, you should do flank liposuction in almost all people. Now, in Colorado, we have very skinny people every now and then, like maybe once a quarter.
I would not even say that, maybe once a year.
Okay, I get someone who doesn't need flank liposuction, but that's literally like nobody. Yeah. Most people post-pregnancy, midlife, they have fat on their flanks.
Even not post-pregnancy, like
whatever. Yeah. Stuff hanging over the pants.
Flanks are probably the most common area we liposuction.
And are you going to make a flat abdomen and not the stuff on the sides? Like, what's the point?
Exactly.
Yeah.
Those are the people who are like, my aunt had a tummy tuck and she looked the same. Well, are you looking from
the side?
From behind?
From behind.
Yeah. Then yes.
And so you want to treat the torso circumferentially. If you do aggressive liposuction, that is very inflammatory, especially with energy, which makes the results better. That's where the drains really come in. So you could even do a quilting suture and probably still need drains.
Still need drains. We even sometimes would put a drain
Yeah.
after just really aggressive lipo.
Now, there's two things that people don't like about drains. Number one, they don't feel great. And secondly, they don't like where a lot of people bring it out through the pubic hair area. So not only would you have an incision that goes from hip to hip, okay, you would have two small little scars present where your pubic hair would be. A lot of women don't have pubic hair, or they shave it off or do whatever they do. So that would be visible, and I get why that would bother you. You can bring the drain out through the incision line, right? So you don't have an extra scar. And that's what I do for people that don't have pubic hair. Okay.
Well, or when we only need one drain, we'll just pull it out one side.
Yeah, one side.
And honestly, I mean, from a patient perspective, the drains coming out the sides are usually less comfortable. They're more uncomfortable when they do that. So, there's pluses and minuses to drain location, but either way, we've never had, that's not true. We have one time revised the pubic incisions from the drain, but we have many times revised the ones on the sides because they tend to not scar as well. So yeah, the drains are a necessary evil is what we're really getting at.
There's nothing wrong with drainless surgery. I think it's cool. I like quilting sutures. We're not against that, but it's kind of losing the forest for the trees. And then you'll go into these offices, and like the only reason I know this is because patients come back and tell us, like, oh, Dr. So-and-so, Dr. Amazing.
Dr. Amazing.
What was I? Fantastic? What was I?
Yeah, you're Dr.
You're
I'm
fantastic.
Dr. Fantastic. So Dr. Amazing, who I think fantastic is better than amazing.
Oh,
personally.
absolutely.
So
Amazing is
Dr.
overused.
Amazing said that he does drainless surgery. Can you believe this? I'm like, yeah. Okay.
Great.
Good.
Yeah.
That has really minimal to no bearing on the outcomes, no matter what they tell you. So
If you don't have a drain and you're building up fluid on the abdominal wall. Yeah.
Right. And so I think quilting sutures do have some benefit. They do take off a little bit of tension on the skin. I do a high lateral tension abdominoplasty. I use deep superficial fascial system sutures that are permanent. I do a lot of these special sauce things that you don't even have to worry about. I do a lot of cool stuff too. But overall, in terms of outcomes, it's a loss leader, period. So do you think we busted this myth?
We did. There's one other thing, though, I want to say
Okay.
about fluid buildup on the abdominal wall. So let's say you have drainless surgery.
Yep.
And you had all the quilting sutures and you're still just building up fluid on your abdominal wall faster than your body can process it. And it is uncomfortable. And it looks like your belly is a gigantic waterbed and it's building every day. And it's starting to put pressure.
There's someone listening to this who had drainless surgery who had this problem.
Yep.
I guarantee.
What has to happen? Well, you have to come to the office and we literally have to stick a big needle right into that area and suck all that fluid off with syringes. And this can happen even when you have drains. However, it's far more likely to happen if you don't have drains because that fluid, your body is working really hard. I always remind people after surgery, your body does not know the difference between a surgery that you chose to do and just massive injury. To your body, this is just, whoa, like
This
we
is
are
the samurai
injured.
sword example.
This is the
that I
samurai
said.
sword.
Yeah.
Bring in the samurai sword. Like you're having to recover. So fluid is going to build up. Inflammatory fluid is going to get there. Your lymphatic systems have literally been dissected. They're cut right across.
Lymphatics go vertically. They go with gravity, right? And they follow your blood vessels. Your blood vessels run vertically through your body. They don't go from the sides because they run from your heart down and your heart up. And that's the way lymphatics go. And you do a horizontal or perpendicular
Samurai incision
from hip to hip. You're going to divide all the lymphatics that are in that soft tissue there. Now, there's deeper lymphatics, right? But they're not draining the soft tissue anymore. It takes a while for your body to bounce back from that.
Yeah. So if the idea of drainless surgery is so amazing to you and the idea of being manually drained with a big needle stabbed right into your stomach is no problem, then there you go.
All right. Come on. You do this sometimes.
Everything has a trade-off.
You remind me of my wife, Barb. Like you are
that is
so
a huge compliment.
I know. You are so
She's
amazing.
like the smartest woman alive.
You are so intelligent. You are so amazing. And then you just, every now and then, you just have to take it the next step, okay? Just leave it at this step. We don't have to go to the next
No,
step.
that's what I'm just saying. People should understand that they're, okay, so what happens if you have drainless surgery and there's still fluid that builds up there?
You have to drain
it's got
it
to
off.
come out.
Yeah.
So just always, that's fine. But I, again, like people to be prepared.
Yep.
Myth busted.
Busted.
All right. Here we go, Nils. Number 8, Swell Hell. Not a myth.
Not a myth.
First non-myth.
This is not a myth. So Swell Hell.
Wait. How do we handle this?
I know. So this was actually one of
I'm
our
very confused.
fabulous listeners actually brought this up to us that she read on a Tummy Tuck group about Swell Hell.
So I remember she was from California and she was in a Facebook group. Mm-hmm. And she talked about Swell Hell, which I'd never
We'd never heard it called that, but
and
it's
I think
real.
we talked about it in the first Tummy Tuck episode.
It was one of our questions from viewers.
Oh, is that what it
Yeah,
was?
the first Tummy Tuck episode was a really long time ago.
Yeah.
So this was a question from this, and the question from viewer came well after that. And that's where Swell Hell came to our vernacular. And it has remained because Swell Hell is real. Swell Hell is not a myth. Like, you will have swelling after your tummy tuck for months, not weeks, not days, months. And it will come and go. And it'll be really annoying because you'll think it's gone. And then you'll like eat a really salty meal, or you will have your period and you will bloat like crazy and you will swell again. And you will call me panicked that you are swollen. Something must be wrong.
All the fat came back in one
Right?
day.
The fat came back. It's back. Well, hey, we're talking about skin here, not fat. But
Well,
I mean,
whatever.
yeah, but like
You know what I'm
something is
talking
wrong.
about.
So yeah, like after a tummy tuck, especially a tummy tuck with aggressive liposuction, as we've discussed, like you will be swollen. And your abdomen might look even like more sticky outy or protruding than it was maybe before surgery. Like the skin is gone, but it might be protruding a little bit more. And that's inflammation. And inflammation is a powerful thing. There are things you can do to mitigate Swell Hell.
Oh, so we love these things. One of the things we're getting pretty soon.
Yeah, hyperbaric oxygen treatment.
Yeah, we're getting a hyperbaric oxygen chamber in our office. I'm super pumped up, from Germany. You can do cryotherapy. There's pictures on our social media of Amy.
After your drains come out.
After your drains come out. We've said that before. You can do lymphatic massage, which is really good, but you have to go to the right person for that. What else can you walk? You can walk.
Walking, acupuncture, even rebounding is actually really good for inflammation.
What's rebounding? I don't even know.
So like just kind of bouncing up and down on an exercise ball. Like right after surgery, you obviously don't want to be on like a little trampoline, but like if most people have an exercise ball at home or at their gym, like literally just sitting and bouncing, really helpful for moving lymphatics. It's just that vibration. If you have a vibration plate, even the ones that vibrate just on your feet.
There's some at the gym. I always wonder what those things
Yeah.
are. Yeah.
Yep. Great for inflammation.
Huh,
Like really
interesting.
helpful for
God,
inflammation.
You're so like you have all these.
Yeah. It's
amazing, all
like
this
I
stuff.
do this.
It's like you're MacGyver of recovery.
I am the MacGyver of recovery. Yeah. So there are many things you can do to help, but even all those things. My favorite is when people like they're swollen after surgery, like I have cut out all sodium, which I'm like, well, actually you need to add some sodium back in. That could be why you're swelling. That could be adding to your swelling. I haven't had a drink of alcohol in 2 months. You know, all these things, like it's not you. Like swelling is happening inside because your body's trying to heal. Are there things you can do to make it better?
It is funny when like, so someone's had a tummy tuck and they come back from like Napa, and I went to the French Laundry and I drank wine all night and I had a very rich, salty meal. And I was swollen afterwards. What do you think happened? I'm like, well, it's what you ate and drank.
Right. Or went for a hike or whatever. You'll fill in the blank activity. And then I was swollen. Like, yep. Even though it's 6 months later, like, yeah. You know, we've also done something with the surgery is we've created space where there was no space before, and your body has to heal that space. Mm-hmm. So it's going to have a more ability to swell. Also, what happens though after surgery is because you are so tight, even subtle changes in like your inflammation or in gas, as Dr. Martin brought up earlier, is going to be really uncomfortable because it's got nowhere to go because we've pulled things so tight. You know how many times people have asked me after surgery if you've done something to their stomach after surgery?
Yeah, it's true.
Yeah. Because like
did you make my stomach smaller?
You're not used to that pressure. You know, our organs have pressure sensors, not pain sensors. So they respond when there's pressure. So when there's always pressure on them after a tummy tuck, they don't respond the same.
Right.
You know, that also slows down movement in your intestines, makes your stomach feel full.
I said this story before. Like one of the first tummy tucks I did get now, we were in Aspen, and it was a lady who was abnormal or a little bit overweight, but she had like a really thick kind of apple belly, and I really tightened her stomach muscles because I was overly aggressive, right? I was like, oh, I'm going to give her the best tummy tuck ever. This is before I had all the wisdom. I'm like, well, you can't fight mass on the inside. It's just physics, and it doesn't matter how many sutures you put in, that will pull out. So afterwards, she was really struggling. She couldn't pee, and we put a Foley catheter in her, and then I transduced the pressure from the Foley catheter to see what her intra-abdominal pressure was, because that's translating through the Foley catheter, which goes into her bladder, which is in the belly or in the cavity, the abdominal cavity. And it was elevated. It wasn't at the level of an intra-abdominal compartment syndrome, which is a surgical emergency, but it was definitely elevated. And that was really made me aware of the limitations of what you can do with that. But Swell Hell is real. You'll get people to come in 2 months out, 3 months out. They look amazing. And then they'll come back 4 months later after that, and they'll have like a bad day or a bad week of swelling.
Yeah, it's not
that usually resolves over time, right?
Oh, it always resolves. It might be, I mean, for some people though, it can take up to a year, you know, before it really resolves. And it can make you kind of feel like you're crazy, you know, because it can show back up when you're, 6-8 months out from surgery. There are also patients who come in like a week after surgery and are barely swollen at all and like never experienced Swell Hell. Those are also the people who probably like, were in labor for like a half hour and pushed once, like life is not fair.
Yeah, we hate those ladies. But
it's not something you can change.
You know those types.
Like you're swelling, like
Oh, I had this neighbor in when I was up in the mountains. She was amazing. She was a wonderful person, but she was so perfect. She used to make the fruit roll-ups for her kids herself.
that's what my mom did. There were no
Of
fruit
course she
roll-ups when we
did.
were kids.
Yeah, and I was like, we buy them from the supermarket.
They're actually way more delicious when you make them yourself, and they're actually
We don't make them ourselves.
they're really easy to make. Oh, they're so good. If anybody wants a recipe for homemade fruit roll-ups, hit me up. Amy at Jason Martin MD.
Oh wait, this is confirmed.
All right.
Sound effect for that one.
Oh yeah, we do.
Number 9, Dr. Martin goes to you.
Amy, men don't get tummy tucks.
That's a myth, Dr. Martin.
Yeah.
Men get tummy tucks. Men need tummy tucks. Men have loose skin. People who have not had children. Let's just put it that way. Like tummy tucks are not just for people who've had a child.
Right.
And there are a lot of people who've had kids who don't need tummy tucks. Again, there's those genetically blessed people. Men need tummy tucks for a variety of reasons. Even men who have been, let's say, at a normal weight their whole life can still have laxity because of the elastin in their skin is maybe not that great. Or they just want a really flat abdomen.
Right.
You know,
And maybe they're more likely to get a mini tummy tuck than a full tummy tuck, but for sure, men get tummy tucks. Now, we have an obesity epidemic in this country. More people are getting bariatric surgery, and those people have consequences after weight loss that are also functional too. You get people with 100-pound weight loss. They have large penises, skin that hangs over, that needs to get rid of just for them to be functional.
even someone who maybe has only lost like 50 pounds but was overweight for a very large chunk of their life, that skin is never going to bounce back.
Nope.
It just isn't.
I mean, I have laxity in my lower abdomen just
So do
from
I.
the weight loss that I had.
Yeah.
Yeah, but you hit it with your stomach vacuum.
Yeah, I can hide it with my stomach. Actually,
know how to do what
even when
you
you
did.
stomach vacuum, if you pull on that skin, you can still move it. But,
Yeah.
I mean,
That
absolutely.
was like black arts. I don't know. It was,
awesome.
I felt.
Oh my gosh! Like I'm serious.
You
when
were
I
a
do those,
shapeshifter.
when I do those in the sauna in the mornings when I have nothing in my stomach or anything. Oh gosh, it's
That's
really
when you should
freaky.
take your photos. for-
Oh, I
for your
would.
coach.
If I was, it's right. You'd be like, stop doing that, you freak. Yeah. Like, you know exactly what I was doing. But with all the surgeries we do, and I feel like we've gotten a little bit better about being more inclusive when we talk about surgery. There is the stigma that only women get a lot of these procedures, and that's just not true.
No.
Men get tummy tucks, men
Yeah.
want their bodies to look better. We probably do more flank liposuction, same amount on men and women. Men want their body to be adjusted too.
Men have more visceral fat, and that's in large part why they, one of the reasons why they have a higher incidence of cardiovascular disease. Visceral fat, the fat around your organs, is the fat that's bad.
Mm-hmm.
It's the fat that truly can lead to death.
And that's the fat we can't lipo.
Right. So you'll see men carry their fat in their bellies, that visceral fat around their organs, so they have that pot belly appearance, and they carry it in the flanks or on the sides. Women carry fat more like a pear. They'll carry it down on the legs, the inner thighs, the saddlebags, the knees, the thighs in general.
You've seen those memes?
Yeah.
They're mostly usually from a bodybuilder woman or some, an athletic woman who's like picture like next to her boyfriend. It's like her leg, it's like huge and muscular, and the guy's leg is like this little skinny twig. I'm like, yeah, like that's my life. Like I got those thighs. Like I'm like a centaur.
I got good thighs, but my calves, I feel like God or nature didn't even give me calf muscles.
Yeah.
I feel like I just have bone there. Like I have a tibia and a fibula.
Right.
Yeah.
And you work your legs. You
That's
don't
all I
skip
got.
leg day.
And then you see Nils come in, and he's like, oh, let me just set my calf muscle down over here. He needs like a special carrying case for his leg muscles, Oh, it's so annoying. I got broad shoulders. I got that going for me.
Yeah. Yeah. So men get tummy tucks. 100%. This myth is busted.
Busted.
All right. Number 10, the final myth. I just need to work out harder.
Yeah. So that's what everyone at the gym will tell you when they're charging you $100 an hour for their services.
Well, or your Pilates instructor or the
Yeah.
woman selling you collagen supplements online.
Yeah. Yeah.
You just need to do this X thing.
Anyone and everyone that tells you that is usually profiting off you working out harder.
Yeah.
Now,
or drinking, magic tea or whatever they're trying to sell you.
of all people, Amy and I are going to be the first ones to tell you that working out is the place where you start. That's where you start in your life. Nutrition and exercise is the way to have longevity and a healthy life.
But it also cannot cut skin.
But
or
it
remove
does not tighten skin.
Or remove skin. It can tighten skin. It cannot remove skin.
It doesn't tighten skin. I think naturally the elastin in your skin will go down when you lose body fat, or the elastin in your skin will work as you lose body fat to bring your skin down.
Well, and as your body remodels to its new size, like a person who loses weight pretty rapidly might have a lot of skin laxity initially, but like in a lot of cases, especially really young people who come to see us, it'll tighten back up. You'll be fine.
You want to get weirded out. So look at me now. Like go on the YouTube channel, look at me right now. and then look at me 3 years ago. Like look at our thighplasty video or one of those videos. I had precipitously lost probably like 20 pounds. And my facial structure was different. Like things were different in my body. And it's
you
crazy.
Lost weight so fast.
Precipitously to see how the body has to catch up to that, which is really crazy.
Yeah. And in some cases it will, like a face, right? Absolutely will. And like on some people, the abdomen, especially if they're young, and we're not overweight for very long. However, when your abdomen, when you're 5'2" and you carried a 9-pound baby to term, or you had twins or triplets, like that skin is never coming back. No amount of working out is going to bring that skin back. Ever.
I feel like insurance companies, if you're having triplets, should just cover the tummy tuck, know?
But is it your insurance's company that you had a fault that you had a tummy tuck?
No.
Or that you had a baby at all?
That's a good point.
Yeah. Like, how is that fair to the people who did not have a baby?
Yeah, they weren't
Do they just get that money?
encouraging them like, hey.
Right. Like, here, we're going to.
You guys should definitely consummate tonight.
Yeah. But I think
this is a good time.
This is also, Dr. Martin, where I wanted you to talk more about rectus diastasis, because we hear this all the time, that women come in like they have a rectus diastasis and their Pilates instructors
we
told
said
them
this in the previous tummy tuck thing. So I love the woman who did Pilates with me. She was empowering. She's amazing. She was positive. She was amazing. She was an amazing person, but she definitely believed that Pilates was going to fix these diastasis problems, and it maybe could help because it could strengthen your muscles. But once those muscles are anatomically in the wrong position, strengthening the muscles, which it only strengthens it honestly in more of a kind of a vertical direction, because that's the way those muscles fire, and the other ones are pulling kind of out.
Yeah, all your obliques are kind of pulling them apart even a little more.
Apart even further. You're not going to be able to like somehow maneuver those muscles in. And the physical therapists and the Pilates teachers will say this all the time. I don't think they're being malicious. I think they believe that. That's
well, and
part of
can
their
they make
teaching.
it functionally better? Yeah.
Yeah.
Can they actually
They're not going to
repair
anatomically put it back.
No.
So.
I mean, what's in between your, the rectus muscles, right, is fascia. So when that pulls apart, you see it in women, we call it the linea nigra, where there's actually like, it looks like they have a black line right down their stomach during pregnancy. Yeah, I know. That's because that has torn and blood has filled that area. So that's what was happened there. So that's fascia that's torn. Okay. So your fascia is now separated. And like Dr. Martin said, all your muscles are then kind of almost working against you to bring that back together.
Fascia is like pretty much avascular.
Yeah. It's also not contractory.
Yeah, it doesn't have elastin in it.
You can't fire your fascia.
And FYI, when you make your stomach...
Horses can, actually. Horses can't. That's how when you see horses like do the little like shivery thing, it's actually because they have different connections from their muscle to their fascia.
How do you know this stuff? Like you were a freak.
Yeah.
Like I know a lot of things, more than most people, and you pull shit out of your ass so amazingly well. How do you know this?
Anatomy. You talk about weird things in anatomy. God, but yeah, people cannot.
Is this what Darwin taught you in the...
It was actually Cole was my anatomy instructor.
Cole,
Darwin was sports
Cole.
massage.
Yeah,
Cole
was
the, But so you cannot tell your fascia to fire. Your muscles can bring the fascia along with it, but you can never pull your fascia back together through thought or
Right,
purpose.
And if your muscles like crisscrossed in the middle, and then you made them stronger, that would just kind of pull them together. But since your muscles in the midline fire vertically, okay, so there's no way to bring that back anatomically to its normal position.
Yeah. But
every week we get people in, they say that, I've done Pilates, I've done this, and they said they can help, and it never does. I've never had a patient come in and say that this solved my problem. It could make it better. It'll make your core strength better, which helps. It helps the stability of your core and of your torso.
And for some people that might be enough.
Yeah. But it's not going to solve the problem. So categorically, we do diastasis repairs, and people, and obviously some of this could be placebo, but they perceive as having more strength, more stability, and better exercise functioning. That's 100% what we see in our clinic and in our practice. But I mean, clearly that's not studied. We don't have data on that. They're not doing EMG studies or MRI studies or strength studies. Yeah. And I don't know how you would do that.
That's really easy. The same way they test like glute firing. We need to hook up with Brett Contreras from the glute lab and get him to come do the ab lab with us and like do the muscle stimulation testing on women pre and post.
I think Brett has probably some other things to do. I think he's totally fine.
Okay.
Yeah.
So let
me fly to Denver from California.
He lives in Vegas now.
Oh, he does? I thought he was in California.
He was,
Southern
but
California.
he lives in Vegas now.
Oh.
Yeah, that's where all the cool kids are going. Yeah. So you just need to work out harder. No, like again, like you work out hard. We believe you. Like we believe that you work out very hard, and we believe that you avoid salt and alcohol and you don't eat sugar. Like, and none of that is going to make your excess skin go away.
Right.
Like we believe you. Honor you love your body. We believe that too. Like these are all things that like you didn't choose to have this loose skin, and you also cannot work it out away.
Right.
Yeah. Regardless of how you got it, whether it was from having a kid or not. Like,
Are you ready for me to say it, Amy?
say it.
Busted.
Awesome. So I have thought, with these
I don't want
busted
this
episodes.
episode to end. We have to keep doing the busted.
Well, I
This is the
have
best
these real myths, but I think eventually I might start doing some episode of like tales from the clinic where it's like things people will say to me like, this is happening to me. Or like, this happened after this surgery, where I'm like, yep, and here's why. And it's usually something weird. And like some of these things I now bring up to people because, or like when they ask a certain question, like they might ask a question that is a normal question to ask. And I might fill in the blank with, yes, that's okay. And this might happen. So tummy tuck is one of those where there's a thing that I tell people and some people take it in stride and other people seem weirded out by it. But
Is that the labia will sometimes be swollen?
No, that happens after lipo. We talk about that all the time. The blue balls too. No.
We did liposuction. We said this story before, and a man, and we did a pretty aggressive liposuction on his abdomen, and his scrotum swelled up to almost double the size because all that swelling fluid went down in there.
Well, it turns kind of purpley because it's bruised, not because it's like avascular.
Like I had a severe problem.
Yeah. Well, and he was
and I was
talking.
like, "You're fine." He's like, "Are you sure?"
Yeah.
And Amy's like, "Just elevate it." And I'm like, "Okay."
No, I told him to elevate his legs. Like I didn't tell him to elevate his scrotum. Like you need to get your legs up. Like it's something.
I took it as elevate the scrotum,
No,
but that's
that's
just
not
what I heard.
Yeah, the best part though was that same person on the phone with me was like, didn't want to say it, and I said it, and he's like, yeah, but like really purple. I'm like, yep, really purple.
Because the bruising goes down with gravity too.
And bruising looks, especially right after some types of liposuction, like when we did smart lipo. Oh my gosh, remember the bruising we get smart lipo? Yeah. Odd colors like that we don't see with other stuff. So yeah, you can have wicked bruising, intense bruising, I should say. So those are the myths. I hope you liked them. If you would like us, okay, it's 2023, and not a lot of people have been leaving me questions. I have some in reserve, but like I love doing the Q&A episodes, but like I need some questions or some myths. Like send me your tummy tuck myths.
Yeah.
Here's all the things. Here's the phone number.
Yeah, we get a lot of engagement. Leave her a question.
Phone number 303-630-9038. So leave me a voicemail. Nobody leaves me voicemails anymore. It's because I've started begging for them again. So now I'm just kind of sad.
Yeah.
Yeah.
Why is that?
I understood why no one left them when I wasn't asking for them, but now I'm just sad about it. So so leave me a voicemail or send me a text. You can text this same number. And if you enjoyed this episode, please do leave us a rating, a comment, a review. I think we need to do one of those things. So like if you want to leave us a review that is not a 5-star review, that we have like a better idea for you. And maybe, Dr. Martin, what's your favorite podcast? Maybe they should go listen to that instead.
Oh, there's so many right now. I just can't tell you.
Pick one.
I can't even. Why are you doing this to me? I hate you. I mean, if I'm being honest, my favorite podcast always is Kentucky Sports Radio.
There you go. So if you thought this podcast was terrible and you are considering...
But I mean, nobody was going to listen to that. I mean, it's
leaving us a bad
esoteric
review. Go listen to Kentucky Sports Radio and you might like that better. So thank you everyone so much for listening, and we will see you next time.
We'll see you next time.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.